Hey, what's up, listeners? This is the sixth episode in our Health Highlights series recorded live at the Health Conference in Las Vegas. We asked leaders how they're seeing the consumer point of view being incorporated to bridge the gap between traditional sick care and consumer-based well care. So you'll hear from Muthu Alagappan, founder and CEO of Counsel Health, Ryan Jacobs, Senior Vice President of Strategy and Partnerships at Marathon Health, and Lior Rauchberger, CEO of Gene by Gene. Let's get into it.
Excited to be here. My name is Muthu Alagappan, the founder and CEO at Counsel Health. We are an AI-enabled virtual care company. My own background is actually as an AI researcher who then became a practicing physician. So I'm an internist by training and have been in digital health, helping build companies for the last several years.
Okay, so you said there was just an announcement, something pretty big going on with Counsel Health. Tell us what that was.
Yeah, we're really excited. Late last week, we announced our Series A fundraise. We raised $25 million, co-led by A16Z and GV. And alongside that fundraise, we also announced that for the first time, Counsel Health is now available to consumers directly in 40 states, which means that any person can go to our website, sign up for an account, unify all of their health records in a single place, and then access a leading medical AI completely for free for both advice and guidance. And then anytime you need care, with a single press of a button, you can have a real doctor from our team join the conversation. So you get the best of both worlds. You get leading medical AI, but also real doctors working together to deliver very personalized care to you. And we just made that available late last week.
Well, congrats on the raise.
Thank you.
Congrats on kind of the promise of that. So how does that translate for a consumer, someone who is trying to understand their own health and wellness choices?
Yeah, what we found is that AI makes it possible to create care models that have never before existed. And so much of what we saw in the clinical AI landscape were people taking AI and using it to retrofit existing care models. We sort of flipped that on its head and we said, what if we observe the way consumers interact with technology today and built a care model around that? And so what we find is that most people, and this is increasing with time, start their health journey on Google or ChatGPT looking for medical advice. And so rather than shying away from that behavior, we said, what if we actually embrace it? And so we built a care model that allows patients to seek medical advice the same way they do today, where they can enter a question, a concern, and then chat with a leading medical AI that's personalized to you based on your health records instantly. So no waiting for appointments, no in-person care, no scheduled visits. You can start the journey the way consumers already prefer to, online. And then we brought doctors to that interface. So rather than making them come to legacy healthcare, we said, what if we put doctors where consumers already live? And we found that to be really valuable.
So is that part of how we help bridge the gap between traditional care and preventive care? Tell us kind of what your vision is for that.
That's exactly right. A lot of the care models, and as a physician, I've practiced as a PCP, as a hospitalist, but these care models have been around for, in many cases, decades or centuries. And so you do start to wonder, are those care models still the best ones for today's environment, knowing what's capable now in terms of technology components and technology ability? And while those care models do have their own place, we're really big believers that new care models need to arise and need to be born that are born with the knowledge of modern technology and what it's capable of. And so for consumers, we've tried to build something that feels really modern, really elegant, really convenient, but still maintains the safety and responsibility that you expect anytime you're seeking care.
What other trends are you paying attention to just in general? That just things that you're kind of in the middle of your radar screen right now.
Yeah, a couple things that are top of mind for us. One is the lack of supervision with generic chatbots and how, as people increasingly use any number of chatbots to get medical advice, we're finding two things are happening. One, those medical chatbots are often prone to hallucinations, and there was a great Nature paper that came out earlier this year showing that the hallucination rates can be upward of 50%. The second thing we're seeing is that sometimes generic chatbots can over-rely on sending patients to the emergency room or urgent cares as an immediate next step. So no matter what they think you have, the tendency of the chatbot is to make sure you're seen somewhere in person. And while that is good for safety, it's not great for medical costs and cost trend. And so as we've thought about combining our medical AI with real doctors, we've thought about how do we solve those two problems? How do we make it that we're not over-escalating? And how do we reduce that hallucination rate effectively to zero? That's been very top of mind for us. And I think we're also seeing increasingly that consumers are taking health into their own hands. They're sort of rejecting traditional concepts that you have to have a PCP. In fact, 100 million people in this country don't have a dedicated doctor. And instead, they're going and seeking and basically piecemealing their own care through, a HIMSS or a Roe and a maybe a women's health provider and an urgent care provider, and they're sort of assembling their own care team through direct-to-consumer channels, and we're keeping an eye on that as well.
What's your advice to someone who, like you said, 100 million Americans don't have a relationship with a primary care provider? When it does come time to seek some care, what's your advice for that consumer if they haven't done what you just said, if they haven't assembled a care team that they're happy with and they're just confused by the whole system, they're just struggling to navigate it? What's your advice to them?
This is where I think we get it wrong sometimes in traditional medical establishment, where, our advice is very generic and we just say, we think you should have a PCP. The problem is that there aren't enough PCPs for everyone to have one. And wait times to see a PCP are 30 days or more in almost every major city. And so it's not enough to give a safe answer of, just go see your PCP, because that's unavailable to most people. And so we're really excited about platforms like Counsel being your new primary relationship, maybe even your front door. And so anytime you have a medical concern, rather than going to an unsafe chatbot or waiting 30 days to see a local doctor, there may be this in-between where you can see a Counsel doctor or any number of companies like ours for immediate advice and guidance. We do think that has to come from a real doctor, though, which is why we've paired the AI with human physicians. And it's got to be really convenient and easy to access. And so our wait times to see a doctor are under 5 minutes. And we find that makes a big difference.
Okay, what else haven't we talked about that you want to share with our listeners, either about what's going on with the company or just anything else you're excited about?
This is, I think, a very exciting time in healthcare in general. We saw that the first few years of the large language model explosion was very focused on administrative use cases. How do we deploy AI to submit prior authorizations and to be more accurate in coding? And those solutions have their merits, but what I'm really excited about is it feels like a lot of the industry is now turning the page from administrative use cases to clinical ones. And I think that's where really a lot of the value of AI is going to be captured in healthcare, is how do we broaden and democratize access to really high quality care, no matter where you live, to billions of people. And I think we're just in the early innings of that, but I do think in the next 2 to 5 years, these clinical AI solutions will become more robust, more prevalent, and hopefully in the hands of more people. And we couldn't be more excited about that.
Thanks so much for joining us.
Thank you for having me.
Ryan Jacobs. I am the Senior Vice President of Partnerships and Strategy for Marathon Health. We have about 720 healthcare clinics throughout the country in 41 states, and we are serving 3 million patients nationally today.
What is kind of in the middle of your radar screen these days? Like, what trends are you paying attention to? We're here at Health. I mean, you name it. There's, hundreds of vendors talking about it.
Yeah.
What are those things that you're focusing on right now?
So I think it's actually kind of interesting to be at a digital health conference, but I will bring it back to, and really the core of what Marathon Health exists for, is to serve patients at the very front and center of their relationship and where they start the healthcare journey, which is primary care. I think you can look at innovation and you can look at all of the digital health assets and everything else, but I think we have an opportunity to continue to invest and make a more dramatic change for how primary care is equipped and able to help patients throughout their healthcare journey. Today, we have a massive shortage, which is projected to get even worse for primary care providers in this country. And I think that is somewhat a combination of the payment model and the system that they have to operate within. Primary care physicians are selfless. They go into this to help people. We want to see them. We want to create an environment for them to continue to help people. And with what we've built with Marathon, we have tried to create a structure that allows primary care to operate at the top of their license, to give them the time with the patients, to do the wonderful and amazing work that they can do.
The heart of everything here it comes down to a relationship with healthcare. So either that's with a primary care provider or that's a consumer who is struggling to understand how to assemble that team themselves,
right?
Which probably happens way more often.
It does.
Depending on, clearly a lot of factors, but one of those factors is trust in the system or trust in that relationship. How do you help someone gain trust in a system that maybe they were questioning before? Because I believe in the model that Marathon Health has here in terms of the relationship that is offered and the need for it and how valuable that is for the patient. How do you convey that?
So I'll answer that in two ways. But for us, we believe we have built an incredible model that resonates with patients. Our NPS today, which may shock you, but is 89. And we've gotten just around 90. And if you think of that in the bounds of healthcare and what people are striving for, it's unfortunate that it is as challenged as it is, with a lot of them hovering between 30 and 50. And part of why we've been able to achieve such a high NPS rating is that we put this patient at the center of everything we do. They don't wait in our waiting rooms. They come in, they go right back to an appointment with their physician. They can book same day, next day appointments. with a team. And then when they are with us, they're with us for upwards of 30 to 45 minutes. We can cover everything that's going on in their healthcare journey. If they end up needing to go to a specialist, we will help them figure out the best cost and quality specialist to go to, and we will help them get the appointment. So to a patient's experience, they now have this robust clinical team who's thinking about all the different ways they need to navigate the system, who's thinking about their nutrition, who's thinking about their mental health, who's thinking about everything that they're going on through. You can walk out with a prescription day of, you can get your labs drawn there. It is somewhat of this holistic model all in one building, and we allow patients the freedom and the time to engage with our teams. Because of that, we see patients come back frequently, over and over and over. And I think creating something that is built around what the patient's needs are is what resonates from an engagement and a stickiness perspective.
Okay, well, this still comes back to that being able to be integrated in a relationship with a care team, with a provider. And like you said, the aspects that you just described of the patient experience, those are, of course, the things that somebody remembers. And those are the reasons why somebody would come back and recommend it to someone else. So how can we scale that, I guess? Like, how do we get more entities out there to understand that that's really what this comes down to improve people's trust in healthcare, their ability to get the things done that they need to get done? How do we do more of that?
We're actually we're doing our part as best as we can. Our business and the care that we provide really we have always been direct and advanced primary care. That's the core of what we've always done. We haven't adapted from something else. Our core customer and relationship in that to provide for these patients has been through employers. We are now taking a leap beyond that, and that's part of the work that I'm focused on, is to now expand beyond that and not work just directly with employers. We will always continue to do that. But now, how can we collaborate with health plans? How can we expand the access that we have so more patients will have access to this? Historically, you did not work for an employer that was a customer of ours. You weren't able to get access with us. And so now we're trying to look at different ways that we can expand that access to make sure more and more patients can have access to it.
What else about partnerships specifically contributes to that growth and that model of how that is going to scale? What types of partnerships, I guess, are the most valuable in that process?
Well, I think most of us access healthcare today through some type of health insurance. And so partnering with health insurers is one piece that we're very interested in, and we'll continue to expand and look at different ways we can do that. And then we're looking at other ways that we can find different partners that will provide greater access to patients that we're interested in supporting. We would love to build more and more clinics all over the country. Obviously, there's constraints with that. So we'll continue to invest in the right markets and find ways that we can provide access to people. I think the other piece is for everybody just to continue to change the payment structure and to invest in primary care. One of the constraints that primary care has today, primary care doctors don't want to spend 7 to 10 minutes with patients. They would love to spend more. They are operating within the financial constraints that they're bound by. And so we need to continue to push that change as a system, which I think will create greater access and greater time and greater experiences for patients.
What else haven't we mentioned that you'd like to share with our listeners, either about the work that Marathon Health is doing or other things you're involved in and focusing on?
Well, since we're here at Health, I can't leave out the digital innovation that we're continuing to push. But for as important and as just impactful as our model might be, all of that is enabled by technology. Through to our EMR that we're using to support patients, to the systems that our clinicians use and our care providers use, through to the clinical analytics and cost transparency that we use to help patients navigate and find the next best place to go from a specialty perspective. You're going to see from us over the coming years even further innovation in the technology that we can use to make a patient's experience even better. Today, a patient can interact with us either through a laptop and a desktop or through to a mobile application. We're going to continue to invest and find ways that patients can utilize either asynchronous care or other ways to have interactions with our teams and get the care that they need where they are. We saw this with telemedicine and virtual care through COVID. We're going to continue to invest in areas that makes it easier for patients to have the access and the care that they need where they need it.
Ryan, thanks so much for joining us today. Appreciate the time.
Thank you, Jared.
Lior Rauchberger, Gene by Gene.
All right, so we're here at Health. What are you seeing, or kind of what's been standing out to you these last couple of days?
I've walked around a few times. I've done about 5 laps. Like, the word AI is on every single person's stand-up booth. And I've walked up with a few of them and said, "What are you doing AI?" They say, "No, not much. We just like to give attention." But no, look, on a serious note, there's no question that AI is just everywhere in machine learning, and it's something I've been passionate about for even before it was trendy. Like, I've been following the space for 15 years, and in my industry of genomics and whole genome sequencing, where the data is huge and rich, AI is truly impactful, and it's something that we're certainly starting to lean into. But that sort of caught my attention, that everyone is in that game at the moment, whether they need to be or not.
Wasn't, I don't know, 3 or 4 years ago, everyone was talking about patient experience, and it was on most booths, regardless of what area they were actually in. So we'll see. This does clearly feel different, but in the meantime, what about outside of the conference here? What trends are you keeping your eye on and kind of have been like paying attention to more than that?
Look, the biggest trend in my game of sequencing is cost, and access. Like some of these genetic tests were not particularly accessible, but just because they were so inexpensive. And I've been in the game for 15 years, and this reduction in price has been constant, but there's been this real accelerant in making sure DNA testing is accessible for all different applications. It's in the last 2-3 years, it's really accelerated. And it's now at a price where just the information is exploding, research is exploding, use cases are exploding, the clinical benefits exploding. So we're obsessed with price and more platforms, more choices. We really want to democratize healthcare and allow consumers and patients and their healthcare providers to make more informed decisions based on their own personalized data. I call it hyper personalization, and so that's something that we're really focused on. It's an exciting time in science and health for that.
Was that the original mission or the original problem that you were trying to solve here, or has it evolved at all?
No, we've pivoted. I mean, we've been going for 15 years, and I acquired this Houston company called Gene by Gene 5 years ago, which has been going since 2001. So no, we've pivoted, but we've been on this data, genomics, precision health, medicine. That's been our North Star for about 3 years now. And so we'd like to be at the cutting edge of these things. But initially we only did reporting, and then we got into just the raw data. And then we thought, no, we have to provide the whole turnkey solution. And we also started doing some direct-to-consumer work where we realized that's probably not our forte. It's like a whole different world doing direct-to-consumer. So we're firmly focused on B2B. So we sit in the background. The many companies that provide DNA testing for either doctors or health networks, physicians, are actually using us in the background because we've become so efficient. So we're really probably got 100 contracts in place, and that's the game we're currently focusing on.
If you don't mind me asking, what insights kind of led to realize that direct-to-consumer may not be the right path?
Look, I'm not saying it's not a good path, and many of our B2B customers are consumer companies, and they're doing really well. Sure. It just dawned on me that we've got a team of about nearly 200 people. I just didn't have the expertise or the know-with-all, the skill sets, whether it be in-house or even just the people around us, to get that right. And I also noticed that over the years, and I think this will resonate with a lot of people, that the cost to acquire a customer, in a direct-to-consumer channel has just gone up and up. I mean, it used to be $20 for acquisition cost, and it went to $50, and some companies it's $100. As all these performance media is becoming quite expensive and inefficient, and Google and Meta keep changing their algorithms. And so unless you've got incredible unit economics, it's hard to have an acquisition cost of $100 and to have a sustainable business. So that penny dropped a few years ago, and I did a very rapid tactical retreat out of that and just focused on B2B. And it certainly helped for us.
Well, it's interesting because one of the reasons I was wondering about that was because of how consumers are still just like in general a little out of touch with what's actually possible for them. Even if you take away like price and access, it still feels like there's I don't know, we've been talking today with others here at the conference about, is it like a trust issue, or is it just what happens a lot of times is that somebody will say, well, the last time I tried that, it either went well or it didn't. If it did go well, you're probably likely to at least consider it again. And then you get into all the other aspects of like, okay, well, is the timing right? Am I targeting them correctly? Like you're saying, like the acquisition cost. If it didn't go well, a lot of people just aren't even going to consider something. That's at least been an observation. I don't know how much that scales, but that process, I see it over and over again.
Well, we've experienced that. I mean, I think the trust issue is getting better, but then when you have like episodes like with the 23andMe collapse, that you go backwards again. Like that's not good for the industry. It wasn't great. Yeah, it takes a long time to earn trust back again. But I have seen trust being less of a barrier. I think historically it has been. That's improving, and I'm really focused in our terms of service and our privacy to make sure that data is owned by the customer. It's their data; they own it. They can destroy it, they can keep it. So that's really important. But there's still a lot of education. And, we live in a society where everyone's after instant gratification. And you might have a DNA test for whether it be a clinical reason, medical or non-medical reason. And if you don't have that immediate aha moment, you go, you're going to go, well, so what? I didn't, tell me something I didn't already know. So that's not helpful. I mean, even one of our more useful tests, or very useful tests, is in the area of personalized prescribing. That's medication. So we all, process medications differently. Some people have side effects, some people don't. So it shouldn't be a one size fits all. And genetics plays a huge part in that. But again, if you might be on a series of medications and you might have what's called a pharmacogenomic or a personalized prescribing test, and you might not you might not learn something amazing for the medication you're on today, but those genes that you got from your parents, you've got them for the rest of your life. So it might be on a medication for a year's time or 2 years' time, but because people don't have the aha moment at the very first interaction, they go, this is not for me, which is not really the case. So education is a huge part of continuing to grow this industry. It's probably our biggest challenge, education.
To be fair, not just where you are. Like, that is a challenge continually, and it's rapidly changing. The amount of information is just constantly. I'm constantly amazed, or I feel like I shouldn't be surprised, but I'm always surprised at what health information or misinformation I hear just from friends and family or from others, and like, this, and I'm like, just curious where you heard that, right? It's just
Dr. Google,
right?
Yeah.
I think there's something to be said for sure. So I'll just validate the thought of education can help us get a little further on that. What other ways are you seeing, maybe outside of what we've described so far, that healthcare, you're seeing healthcare becoming more consumer centered, or at least seeing it try to bridge the gap, help people live better in terms of preventive care? Healthcare has made a lot of strides in terms of what happens once you do get sick.
Yeah.
But what else are you seeing in that area?
Look, that's an area that I talk about a lot, is preventative genomics. And I agree with you. Like, when I practice as a physician, everything is thrown to the last 5 years or 10 years of someone's life, but they've already had a stroke, they've already had a heart attack, they already get cancer. It's a bit late then, to be honest. I mean, we can help a little bit, but we need to start 2 decades earlier, 3 decades earlier. And there's a lot more awareness around health span rather than just the lifespan.
Sure.
And I think genetics can play an enormous role. So there's a whole lot of emerging fields where we can tell people, based on their genetics and a combination of hundreds, if not thousands of their genes, what their risk is or their predisposition to all sorts of things, whether it be heart disease or diabetes or osteoporosis or various cancers. And that's about preventive genomics. So if you know that information early, when you're young, when you're in your 30s and your 40s or your 50s, you can do things about that. There's interventions you can do. You can be more proactive. You can improve your lifestyle. You can have more monitoring with your healthcare providers. And I think it's going to have a huge impact. It's going to take a while to filter through, because not a lot of people pay for prevention at the moment. We pay for disease, not prevention.
Right.
But I think if society keeps only paying for disease with the cost of healthcare rising, we're all going to go broke, right? Just there's no money to pay for that, right? So we've got to get smarter and start doing it at the front end a lot more. So it's coming. It's exciting.
Yeah. I want to thank you for your time, and thanks for joining us and giving us a little deeper dive there.
Fantastic. Great to connect. Thank you.
Thanks so much.